Joining us today is Heather Punkari. She is a physiotherapist and osteopathic manual practitioner. She has practiced in Sault Ste. Marie since 2002. Her practice primarily focuses on treating fascial and postural dysfunction to relieve pain and normalize function. Welcome, Heather. Thank you for joining us today.
Thank you for having me.
So tell us a little bit about yourself and how you became interested in physiotherapy and osteopathy.
Well, I guess my path to this place in my current practice was a long yet seemingly natural one. When I was young, I remember saying that whatever I did as an occupation, I wanted it to be something that I loved and had passion for. So as clear as that intent was, as I was coming out of high school, I had no idea what I wanted to do. So on my counselor's advice, I enrolled at Waterloo University and completed an honors degree in biology. And while I was there, I got really involved in weight training and ended up straining my hamstring. So that caused me to seek out some treatment at the physiotherapy clinic they had on campus. And the treatment itself really resonated with me because the whole goal was to try to restore function people had lost due to injury. So right there, I kind of changed direction and I set out to get the necessary course requirements, basically to enroll in the Toronto University program for physiotherapy right on upon my graduation. So while I was working on my physiotherapy degree, I became aware of something missing in it that I couldn't quite put my finger on, but it wasn't quite the right mix for me. But thankfully, it was answered shortly after my graduation when I took a postgraduate course from a gentleman that was both a physiotherapist and an osteopathic manual practitioner. And he spoke of the many interrelationships and interdependence of different body parts that I hadn't really considered or even been taught as part of my physiotherapy training. So after speaking with him on his training, I ended up enrolling in another grueling yet ultimately rewarding training in osteopathy, where I completed 5 years of part-time study while I worked full-time as a physiotherapist.
Wow.
And so here I am in an occupation that I love and have passion for.
That's amazing. Quite the journey that you're on. And it's so interesting that you had a sense early on that you really did want to do something that you had a passion for. And I'm sure like so many students in high school at the time didn't know exactly what that might look like, but you sort of knew the criteria that it needed to meet for you.
Yeah, I guess it all started with the intent, and then it just kind of unfolded, I guess.
Mm-hmm. And so many women in healthcare that I've been speaking to or that I've had conversations with over the years seem to find their calling in healthcare often related to a health struggle that they may have gone through. And it sounds like that is also true for you with the hamstring strain that you experienced and then you subsequently had treated through physiotherapy.
No, exactly.
I think too, sharing that you did additional training, like you had that sense that something was kind of missing and that maybe there might be something else to sort of connect the dots for you. It's, I think, really great and speaks to your commitment to, feeling the passion for the career that you're pursuing and that you really wanted to do that additional learning.
Wow. Learning is like a drug for me. I can't get enough knowledge, it seems. So.
We have that in common. I very much love learning, and I appreciate, hearing from you and you sharing this experience today. And I know that many women are going to benefit from what you're sharing. So thank you for telling us a bit about your story. Now, you mentioned osteopathy, and I've said that word already, but can you define what that is and how it relates to physiotherapy?
Sure. So, well, manual osteopathy is really what you would call a hands-on therapy, and it's based on the understanding the relationship between structure and function and the interdependence of all body parts. With that knowledge, we use a variety of skilled manual techniques to gently kind of manipulate the body's tissue to try to guide and enhance its own inherent ability to heal. Because ultimately our bodies do want to be healthy and balanced. They just need a little help in the forward direction, sometimes based on our history. As far as how they relate, osteopathy and physiotherapy are similar in that they're both client-centered therapies that aim to improve a person's quality of life through interventions that help improve their pain or their function as it results from injury, disability, or disease.
Hmm.
Where they differ, I guess, is in the depth and the scope of the work and the tools and the techniques that are used.
So that's helpful
So,
to have an overview and an understanding of the relationship. And it sounds like they're paired quite well together in the work that you do. Um, I'm wondering if you could say more about, the types of issues that you treat. What are the common ones that you see in women, for example?
well, just to give an example, and it will even kind of highlight the difference in the treatments.
Mm-hmm.
Um, so from a physiotherapy point of view, I might look at a woman who has, right hip, back, and knee pain, and she's got no history of trauma or injury. So I would look more specifically at those areas and maybe what's going on at her foot. I would also consider things like the alignment of her knee, what type of footwear she tends to wear, how old her mattress is, how she habitually stands, and any activities of daily living that might be contributing to the problem, basically. And the treatment plan would include some education, some recommendations for lifestyle or element changes, some electrical therapies for pain and inflammation, maybe some hands-on mobilizing of the tissues directly related to those areas, and a targeted exercise program. But from my osteopathic point of view, I take not only all of that into consideration, but also the possible influences that are coming from, say, the scars in her abdomen from C-sections or hysterectomies that she's had in the past. I also take into consideration any internal scarring that might have occurred due to her history of repeated urinary tract infections or chronic constipation, ulcerative colitis, those types of things. And I even would consider problems coming from more remote areas, like maybe the frozen shoulder she had when she was 50, or the repeated ear sinus infections she had as a child. All of these pieces have the potential to influence the fascial balance occurring around her hip and back and knee, and they'd all be considered in the treatment plan. But from an osteopathic point of view, it's really more hands-on manual therapy. I hope that's clear.
Yeah, I mean, that's so fascinating to hear about the different potential connections depending on what lens you're looking through, and that you can kind of look through two lenses at once and see potentially, more concerns or more things that are in need of support or treatment. And you had mentioned, low back and hip issues and how those could potentially be related to something even going on digestively or otherwise in the body with like maybe organs or tissue. Can you say more about how those might be related?
For sure. Well, in truth, almost everything in the body can be linked either directly or indirectly through the fascial system. There's actually a direct connection of the small intestine to the right sacroiliac or SI joint, as everybody knows it, through the mesenteric fascia. And I often find that it causes people grief in their low back and their hips.
Hmm.
There's actually several interrelationships found in the gut that link what I call the content to the container, but that's just one example. It's common enough for me to find that problems in the container, what I consider to be the musculoskeletal system, is being influenced, at least in part, by troubles within the content, which I consider to be the deeper anatomy, such as organs, brain, and spinal cord.
Yeah, it's pretty amazing to think of, again, everything being interconnected because, we're a whole body, we're a whole human, we're not these separate parts per se, and they do have relationships to each other. And like you said, it might be more direct or it might be indirect. So I think it's fascinating to kind of expand that because so often it seems like, if I have shoulder pain, then we might be only looking at the shoulder, but not looking any further.
No, exactly. And I think that's the common missing piece when people are trying to heal something is it's not always related directly to the area that's creating or where you sense the problem. Do you know?
Mhm. Yeah,
Yeah.
absolutely. I think that is such a great concept. I think that'll be, really awe-inspiring for women to hear that and to start to maybe explore more of what could be going on in their bodies. And you had mentioned the term fascia. So just in case there might be women watching right now who don't know what this is, can you tell us what fascia is and how does it relate to the function of our body systems?
Well, the fascias are actually found everywhere in our body, and there's many different types, all depending on their location and their function. So the fascias, when considered as a whole, can be considered like a continuous web-like tissue system that covers and binds and supports and kind of links our muscles and our bones and our organs. They include, the tendons and the ligaments that most people are familiar with, but also includes the coverings of the muscles and the bones. And some of the fascias are even thought to create what we call myofascial chains, myo coming from muscle within that fascial system. And there's several of these chains and they all kind of run in different orientations throughout the body, linking different structures.
Mhm.
I often liken these to a link of sausages, wherein the meat on the inside is like your muscle tissue and the fat or the casing on the outside is like your fascias. And they contain the muscle and attach it to the one next to it. So with that analogy, you can easily see how problems in one area can easily propagate up or down the chain. Um,
Yeah.
in health, these chains are thought to work together to help stabilize certain structures of the body while allowing movement in other parts of the body. I think it's fascinating to think that not that long ago, the fascias were actually discarded as being insignificant by anatomists, but they've become more and more recognized as an important part in supporting our body's structural integrity and its mobility. So really, the fascias are acting as a scaffolding-like system that supports not only our bones and our muscles, but our organs and our circulatory vessels and our nerves.
Mhm.
Um,
That's totally fascinating to hear that perspective because I don't think it's a body tissue that gets talked about commonly. People talk about muscles or skin or the organs, but this is like a different type of tissue that serves maybe some similar functions, and that's really mind blowing to me that it was considered irrelevant or just extra parts.
yeah.
That's really mind blowing to me. And to think, with what you just shared, how many things that it could potentially relate to, that it's structural, it's functional, it helps with linking, it creates movement and mobility. It's pretty amazing.
It is, and it's fascinating to work with as well.
No doubt, no doubt. So when you are working with someone, what is it specifically that you're looking for when you're assessing them?
Well, first off, I always take a thorough case history, and that's where I'm looking for a history of trauma or injury or inflammatory processes that might have created some scarring or what I call adhesion in the fascial system. Problems arise in the fascias when they're imbalanced or distorted, either by getting caught up due to the scarring or if it becomes unevenly tensioned due to muscle imbalances. Um, and then I tend to take a good look at posture because you can get an amazing amount of information about someone just by looking at how they hold themselves. You can really see how the fascial system is being distorted and how the body's really trying to compensate. I then go into a series of kind of hand-on assessment techniques wherein I try to really get a sense of how all areas of the body are functioning with respect not only to the areas of complaint, but to the rest of the body as a whole.
It's interesting. Like everything really needs to be considered when you are doing, such a holistic assessment and treatment, right?
Exactly. And you never know what's at play. Sometimes, I'll get into the assessment and people go, oh, I forgot to tell you about, but I'd already kind of been led there. It's interesting.
Yeah, absolutely. I could see that. Who are the typical clients or patients that you see?
Um, well, because osteopathy is not as well known or recognized as other therapies, typically people find their way to me by way of referral after they've tried but had some limited success with some of the other excellent, more mainstream therapies out there. So in most cases, their conditions are fairly long-standing or chronic or complex. They really are of any age and can be presenting with any number of perplexing conditions.
Mhm. And the women specifically that come to see you, are there common obstacles that they might encounter in terms of maybe accessing care?
For sure. I mean, as with other treatments that aren't really well recognized, funding is a common enough obstacle. Osteopathy is not publicly funded, nor is physiotherapy actually for people between the ages of 18 to 64. And I don't have a specialized license that's required for OHIP. But thankfully, several extended healthcare benefits packages do include osteopathy and physiotherapy, which is nice.
Mhm.
Um, Another common obstacle, I would say, is the treatment format itself. The work really requires close contact and ability on the client's part to lay relatively still and quiet. So it really depends on the person's comfort level with manual hands-on therapy and their ability to relax. Sometimes people find these aspects of the treatment to be difficult depending on their temperament and also if they have any history of abuse or trauma.
Mhm. Yeah, it makes sense. And particularly, the funding issue, something that's been cited throughout the series by many, if not all, of the healthcare providers that I've interviewed. And it does seem like it can be a potential barrier to treatment. But again, it's a great thing that there's the possibility of maybe reorganizing finances or having access to employment benefits in order to make room for treatment options that might be really helpful for you that might otherwise be overlooked.
No, for sure. And sometimes you don't know what coverage you have unless you look into it, right?
Very true. And I think too, sharing kind of the expectation of what the treatment looks like and understanding that an obstacle might be someone's temperament or their ability to maybe be still or quiet during a treatment is helpful for people to anticipate because we can always potentially adjust our behavior. We know that in advance, right?
No, absolutely. And
Hmm.
so and it really depends what people are comfortable with, right? That's what it comes down to.
Yes, true. Now, are there any current health practices for relieving pain and dysfunction that you might recommend for women watching?
For sure. I mean, I often recommend yoga and meditation. I even teach some yoga pose exercises depending on the case presentation. I think yoga is a wonderful way for people to work their own fascias and the balance in that system. And there's so many different types of yoga out there that people can access that accommodate all levels of fitness and disability. I also like the meditative practices of yoga and how they allow people to access their own autoregulatory system. Oftentimes there's some underlying stress or anxiety in people's lives that disrupts their autonomic system, which can impede their ability to heal. Balance of the system is just so important in the healing process because it supports tissue repair and regrowth. In osteopathy, we have techniques to work that system, but meditation is really the best way that I know for people to access it on their own.
And you mentioned two things that I want to hear a little bit more from, or more about rather. Autonomic system, and you mentioned autoregulation. Can you just tell me a little bit more about what those are?
For sure. I mean, I think most people are familiar with the concept of fight or flight versus common relaxation, right? So that's really the two branches of the autonomic system. And in this day and age, we're all driven fairly high in our sympathetics, um, which creates an imbalance in that system. And so the rest and restore piece doesn't get to activate and um, mediate our system as it should to help that ongoing dynamic that our body always has where it's trying to work towards the better balance, right?
Yeah, definitely. And that's something that I see really commonly in my practice too, that the two aspects of the autonomic nervous system are out of balance. Oftentimes, like you said, the sympathetic nervous system that's responsible for the fight or flight response is the one that is kind of in overdrive. And then the parasympathetic nervous system, as you refer to it, like relax and restore side of things, is just not engaged often enough because of sort of societal expectations and people being busy and go, 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 and not always valuing rest or making time for that. So I love your suggestion of meditation with yoga as well. And then auto-regulation, from what I'm understanding from what you're saying, that is referring to the balance between those two aspects of our nervous system. Is that right?
Exactly. It's just the body's ability to have access to both of those avenues, you know?
Hmm. Hmm. Absolutely, because we need them both. It's not, sometimes I think there's a misconception that, well, then that aspect of my nervous system is bad or wrong, or I shouldn't be accessing it. But the truth is that you need both, but you need them at appropriate times. And then, as you mentioned, that's where auto-regulation comes in.
Absolutely.
So resilience is a topic that is so important to women's wellness. And it's a topic that's near and dear to my heart. I love it. I love to talk about it. I could probably spend hours having a discussion about this question alone. But I'll leave it at this. What does becoming more resilient mean to you? And how does this relate to the women that you treat?
Well, I think resilience is just such a wonderful concept when talking about health and wellness. I guess I would relate resilience to what we call adaptive health in osteopathy. So ultimately, our goal in osteopathic care is to restore the body's adaptive abilities so that people can manage the day-to-day physical, mental, emotional challenges that we all inevitably encounter without significant or long-standing damage to our body system. In my practice, women often report that they physically recover more quickly after a fall, or they recover from surgery faster, or they feel clearer and calmer when they're dealing with distressing events in their lives. I believe um, people can do a lot on their own to really create resilience within their system, balancing the various aspects of health that we're all familiar with. You know, things like balancing strength and flexibility, getting moderate cardiovascular exercise, doing balance exercises, eating a balanced diet, and for sure having a good night's rest. But also the more mind-related activities like doing the meditation, having a supportive social network, cultivating a balanced mindset, and having an effective stress coping strategy to get you through day to day. You know, I really think there's so many ways that women and men can positively affect their resilience quotient.
Oh yeah, very true. And you're totally speaking my language with everything that you shared there. I think that those are so critical and they've been shown in the research to be really helpful for developing resilience and that it's a capacity we all have access to. But we have to acknowledge first that the capacity is there and then we have to work at it. It takes work and energy and input if we want that capacity to be there for us when we really need it most.
Absolutely. It starts with awareness, as we all know, but absolutely you have to follow up with action.
Yeah, very true. Well, I want to thank you so much, Heather, for all your wisdom that you shared, sharing your story and your journey that got you here today. And I appreciate your insights. I think that women are really going to have their eyes open to a different way of looking at and appreciating their bodies and understanding the function from all of the knowledge and wisdom that you shared today. So thank you so much.
Well, I thank you so much for the opportunity to share. I mean, we are much more powerful than we believe sometimes.
Absolutely. I'm right there with you. And thank you again, Heather.
Thank you.